So what are the most common reasons for pain in the foot? Let's understand through this model. So what are the common reasons and what are the locations for various type of pains in the foot? So the most common reasons for foot pain includes if you are obese or overweight, or if you are not wearing good quality shoes, or if your age is over 40 years of age, or you are having flat foot since birth, or you have developed it over a period of time. Then these are the most common reasons why you can develop pain in the foot region. Also, conditions where if you are an athlete and you have to run too much, or you are doing chronic overuse, then also you can develop stress fractures or tendinitis. Now the stress fracture normally develops in these bones. These bones are known as the metatarsal bones, and the stress fracture occurs here in athletes. Or they can develop tendinitis. That means the tendon gets swollen. The tendon normally passes from here, from behind this bone like this. This is known as the peroneal tendinitis. Or it can happen on the inner side of the foot also, in the tibialis posterior tendon. Also, other reasons for foot pain includes conditions like bunion or hallux that occurs normally in patients with old age. So the greater toe of the foot, it starts moving outwards like this. So there is a deformity at this part of the foot. This is known as the hallux valgus. This is normally seen in elderly females. Sometimes a bump or a swelling develops here, which is known as the bunion. Because of this, there is an abnormal load distribution, and on the undersurface of the foot, the person can develop corn or callosities also. Other common reasons for foot pain includes pain at the heel part of the foot. Now this is normally known as plantar fasciitis. So whenever the person tries to walk in the morning, puts the foot down, he gets a pain here at this part of the heel, which is known as plantar fasciitis. Similarly, pain at the back of the foot can be because of this bump here in the bone, which is known as the Haglund deformity, or a bursa gets swollen here, which is known as the retrocalcaneal bursitis. One big muscle that comes here at the back of the foot is known as tendoachilles. Sometimes there is a swelling in the tendoachilles that can lead to pain. Also, if you are diabetic and you are having diabetes since long, then you can develop diabetic neuropathy, which can give diffuse pain in the entire foot. One more common systemic reason that can cause pain in the foot is if it is because of uric acid or gout. So normally that gives swelling here in this part of the foot, and the toe movement becomes very painful. This is known as the gouty arthritis of the foot. Other reasons include if there is any fracture. Now the most common injury to happen here is a fracture at this part of the bone. This is known as the Jones fracture. This is more commonly seen in young or adult people and very rarely seen in children. Also, there can be injury in this part of the bone, which is known as the fibula or the lateral malleolus part of the ankle. Similarly, there might be a fracture towards the inner side, which is known as the medial malleolus of the foot. So these fractures are also very common, and if not treated properly, they can land up into arthritis. So these are some of the most common reasons that we get for pain in the foot, and it is important that if you want to avoid foot pain, you should keep your weight low, wear good quality shoes with proper arch support so that the arch is always well supported, and whenever you are exercising, use proper exercising shoes. And if you are over exercising or not doing exercise in with proper technique, then you should definitely consult a trainer and improve your technique so that you don't develop any foot pain in the future. Thank you.